why you have a low PVA. Hi, I'm Dr. Lawrence Tam from Drive Your Practice. I'm really excited to be fortunate enough to be able to travel around Australia and the world coming up soon to really go through a couple of seminars with like-minded chiropractors, and I'm getting amazing feedback from people on how much they've enjoyed coming to Practice Like a Pro Intensive. Now, I want to share with you one of the key things that the members have actually, the attendees have actually learned in these intensives, and one of them being is that they recognize that why they're actually going so wrong when they're actually dealing with regards to clients' recommendations. Because most of the times when I travel around and talk to chiropractors, their PVA, which is your patient visit average. Now, basically what that means is that whenever your client comes in, and just say a new client comes into your door, and I want to know, I typically ask this question, I want to know how long do they actually typically stay for on average, okay? And most chiropractors will be saying anywhere between 12 or less. And there's a reason for that, why that number 12 is so significant. And here's the reason why, is because most of you, when you go through the whole initial consultation and you go through the whole report of findings, what most chiropractors do is they will give them a recommendation, a schedule of care, whatever that might be, maybe 3 times a week or twice a week. It doesn't really matter what that is, but they will always send off by saying, well, at the 12th visit, we're going to see how you're going. At the 12th visit, we're going to do a progress exam and see how things are. And so what that does, it frames in the patient's mind is that 12th visit is the limit of what we're doing, and that 12th visit means that that's the end of the care. And so, and as you try to recommend wellness care or progressive care or maintenance care, honestly, what that ends up doing is that they're going to see that's seeing as like you're trying to convince me to do other things that I don't necessarily need. See, the problem is that what most chiropractors don't do is they tell the truth. They don't tell the truth right from the beginning. They don't tell the truth of where they need to be and what they recommend right from the beginning of care at the report of findings. See, you got to tell the truth. The report of findings means is that you got to outline everything that's in there for them. You got to outline what it means to them, and you got to outline what it's going to take to get them from A to B. They got to decide. You got to give them the choice. They got to choose the care that they want. But at the end of the day, once they choose, you got to recommend what's best schedule for them. But that means that you start not by pre-framing the beginning, but you start by pre-framing the whole package. What does that mean? What is that length of time? Pre-frame the time frame that you think they're going to take to get there, and then break it down in chunks. See, there's a big difference is that most people frame the beginning. They would just tell them what they need to do in the first few weeks, and that's it. And then it goes, oh, this is what we're going to do. We're going to just decrease the clients, decrease the schedule of care. My suggestion is talk about the bigger vision first, and then chunk it down, because this is where they need to set their framework. Because it's going to take them 6 months or a year or 3 months or whatever months you decide to decide that that's going to be the length of time that they're going to need to get care. That's what you lead with, and then break it down, rather than trying to lead with the small little chunks, because that's going to pre-frame their headspace. And this is why majority of chiropractors get it wrong, and majority have low PVAs, or patients don't stick around a long time because they think that you're basically doing a bait and switch, because you're only trying to convince them to come for 12 visits. And for most of us who are in this game for wellness care and actually for correction, it's way more than 12 visits, and we know that, and the patients know that. As long as you know, and as long as you can show them that they require that. Not every client's going to need that, but if you're going to have massive degeneration over years of problems, you can understand they're not going to need just 12 visits to get them better. They might feel better at 12 visits, but to correct the problem, if that's what they really wanted, right, to correct the problem, not just for pain relief and symptom relief, then you need to frame the bigger picture. So I hope that makes sense. If you want to know more information, I think you should go check out driveyourpractice.com/likeapro. It's a 4-part video series that I've done called Practice Like a Pro. It's free. All you need is an email. Put it in there, and you actually get to see the 4-part strategies that I have for you to help you grow your practice and take yourself from an amateur to become a pro, to start doing the things that you need to do to connect with the people that you want to connect with. So I hope you got a lot of value out of this particular video. I'd love for you to kind of share this video to other other colleagues that you think deserves better of themselves, that they want a better version of themselves, a better practice that they're currently having at the moment. And more importantly, make sure you go check out our Facebook page, facebook.com/driveyourpractice. Love to see your comments there, and leave me a comment on what you think about this particular video. And I'll see you drive your practice like a pro. And sometime somewhere around the world, we'll be doing Practice Like a Pro's intensive. I hope you join us. We'll be in Canada, and we'll also be in Amsterdam, and also be speaking in the UK and possibly in Dubai. So check us out and check out the schedule, and we'll see where we can find you somewhere around the world. I'm Dr. Lawrence Tam from Drive Your Practice. Take care.